Welcome to RhAPPcast, the official podcast of Rheumatology Advanced Practice Providers. I'm your host, Amanda Mixon, president of RhAPP. Today's episode takes a closer look at how obesity shapes the day-to-day experience of people living with psoriatic arthritis and how stigma-free, thoughtful conversations about weight can open the door to meaningful change. We'll explore how excess adiposity influences inflammation, symptoms, and function, but equally important, how clinicians can engage patients with empathy, clarity, and shared purpose. I'm joined today by Jeannette Hart, coming to us from the beautiful Tri-Cities region of Washington State. Jeannette brings a wealth of real-world insight on integrating obesity assessment into routine rheumatology care, linking weight reduction with improved psoriatic arthritis outcomes, and building practical, sustainable, obesity-focused support within the clinic. If you're looking for actionable strategies to improve communication around weight, strengthen partnerships with your patients, and incorporate obesity treatment considerations into everyday rheumatology practice, this conversation will offer both guidance and inspiration. So let's go ahead and dive right in. Jeannette, again, thank you so much for being here. You are, of course, a rock star. Rockstar Rheumatology APP that now actually co-owns her own practice. So congratulations on that.
Thank you. It's an exciting time. I'm glad to be here.
Oh, well, we love having you. So let's go ahead and get started.
Let's do it.
To start us off, can you describe how obesity influences the lived experience of patients with psoriatic arthritis, both in terms of symptoms and day-to-day function?
Sure. Big topic. So a lot to really unpack in that question. But I mean, we think of obesity as a problem for all patient populations. Psoriatic arthritis, it just tends to be a bigger topic simply because we know that about up to 50% of our psoriatic arthritis patients have a BMI greater than 30 or at least at 30. So we have to address the topic. And so when we talk about it or we start to think about it, first of all, when you're carrying around that much weight, the simple answer is that it's going to bother especially the weight-bearing joints. And then there's the other side of that where if you have a lot of adipose tissue, we know that specifically the white adipose tissue can be really pro-inflammatory. And how is that affecting their autoimmune inflammatory arthritis? So I think that number one, from a clinical standpoint, there's the two sides of that, carrying around the weight. And then what is the adipose tissue doing? And then we often forget about how it might feel to have psoriatic arthritis regarding all the different domains that can be affected. A couple of them are pretty invisible. So psoriasis, our patients will cover up. So people around them don't see that. Enthesitis, I can't see enthesitis very well, right? And certainly the average Joe wouldn't be able to identify it. And that's a nagging pain that every time they move that muscle, that hurts. And so we don't see that either. And then we can think about nails, for instance, right? Nails that are breaking or getting snagged on things that might be affecting maybe a laborer's job. That could be really painful when you're trying to use your hands and you have this nail problem. So we have a few of those things that aren't right in our face. And then these patients might be carrying around of extra weight that is right in our face. And so that tends to be what is focused on sometimes is, well, you're hurting because you're overweight and I can see that, right? So I think our patients are dealing with a lot and it's worth talking about obesity and part of the conversation when we treat them.
It's so true. And, again, it's often one of those things that's very challenging to actually, how do you have that discussion with a patient? I know even, personally struggling with initiating these weight-related conversations, you don't want to be offensive. You want the patient to understand that you are on their side and that you're really in this together and you want to come up with a solution. But I think so often, especially in history, patients would get fat shamed, they would be told everything's wrong with you because of your weight. And so it really created this stigma. And so we really need to learn how we have, stigma-free approaches to talking to patients. So how do you feel like we can do this and be productive and supportive with our patients?
Well, thank goodness, first of all, that things are shifting and this can be a topic of discussion without the shame. And I feel lucky enough that my patients are often bringing it up before I have to, but I think we have a lot of opportunity to bring it up if it's not being brought up by the patient. First of all, vital signs, right? We talk about pain. We talk about all of that. So sometimes I'll walk in the room and I'll say, oh, looks like your blood pressure was 130/85. Your pulse was 90. Maybe we need to talk about that. Oh, and your weight is 243 pounds today. And I might just say it off like it's a vital sign. There's typically a reaction when you say somebody's weight out loud to them, right? It's like, oh gosh, yeah, we just got through the holidays. And then you can pause right there and see if that's something they want to discuss. And then you can even ask, oh, is that something you wanted to discuss today? So I think there's an opportunity right there when you're just walking in talking about vital signs, as long as you take the moment to pause and see if they want to address it. I think another opportunity, I tend to ask my patients, what are your top 3 areas of pain today? Hands, shoulders, what's going on? And it's usually knees will be involved, right? Or ankles will be involved, some of those weight bearing joints. And then sometimes they'll say, but I know if I lose weight, that'll feel better, right? You can pause right there and say, you're right. Your weight is the number one modifiable thing that we can do to improve disease activity here. Because just to rewind a little bit, we know patients that are obese with psoriasis have a greater risk of developing psoriatic arthritis. We also know that patients with psoriatic arthritis that are obese are not going to respond to treatment as well. So this is a true problem, and it is going to result in worse disease activity. So I think we have lots of time through our conversations with our patients to listen to them, because they will bring it up if it is something that they're concerned about, and we should give them time to bring it up and discuss it.
I actually love that. I've never thought about using it kind of in that term of like, this is just one of your other vital signs, and then giving them the opportunity to bring it up before we have to maybe sometimes awkwardly, bring it up to them. So I think that's a really, really great strategy. And you kind of mentioned this about, having worse outcomes if you are overweight. But how then can you connect weight reduction with improvement in psoriatic arthritis symptoms, treatment response, and just the broader health outcomes in a way that resonates with the patients?
Yeah, I think once you allow the patient to open that door in that conversation, another place to allow that is if the patient's not doing well, right? If the patient is not doing well and you're changing treatment yet again, and they are wondering like, gosh, is this lady for real? Are we ever going to get anywhere with my disease? Maybe you stop and say, if you even just have a 5 to 10% weight loss, your knees will feel better. And I know that's from an osteoarthritis perspective, but then you can say, and has anybody talked to you about the inflammatory effects of your white adipose tissue, and that tissue is pro-inflammatory? And if we just reduce it and increase some of the more metabolic adipose tissue by way of exercise, then we can improve disease outcomes. And I don't think there's any harm in bringing up a little bit of that science, right? Because you need to have buy-in that, again, it's not just weight loss will make me feel better. Weight loss is always the thing, but weight loss is really hard. Right? It's not an easy thing to do. It takes a lot of grit. And historically, right now, we have really cool drugs that help people with this. But just talking about the science behind it might create some buy-in to help your patients want to grab on and be a part of their treatment plan, and not just cycling through drugs, hoping that one sticks.
I love having that conversation with patients and using science too, because I think it really does help them understand. And I'll even say to people, a lot of this is your genetics. Like, you can have a great diet, you can, be exercising, but you just got crappy genetics that are predisposing you to being overweight. And I think sometimes that takes some of the pressure and the guilt off the patient, because you're kind of saying, hey, I understand that this is not all you. You're not just sitting around, eating unhealthy and not exercising. Because I have a lot of patients that actually do the right things, and despite that, they still can't lose weight. And so, maybe kind of having that conversation too, that says, hey, listen, I know this is not all you. There's parts that you have nothing to do with that are contributing to this. And I can't think of a better person to ask this particular question too, because I know you're incorporating this. So walk us through what it looks like for a clinic to begin building an obesity-focused treatment pathway within rheumatology. Where should these practices start?
So I think first, you maybe just reframe your thought process and maybe your clinic culture that obesity is a chronic inflammatory disease, right? make that part of your culture within everybody who works there. That way, if somebody hears a patient talking about it, they can say, "Oh, hey, have you talked to Jeannette about that?" So maybe just reframing the culture. Make sure that you're screening every patient. Do you document BMI? Are you taking their weight? Hopefully every time. And then embed weight or weight management into the discussion for every PsA and honestly, every inflammatory arthritis patient that you see. Just embed it into your note, your template, any way you can to remind yourself that this has to be part of the conversation. We really can't ignore it anymore because we have so many tools at our fingertips. And then after that, decide, okay, am I going to just be a counselor? Am I going to really be the encourager and spend just that extra 2 minutes to discuss weight management? Or am I going to also add pharmacologic things to my protocols? Am I going to do nights where I have somebody come talk about this and allow patients to come and sit as a group and sort of have a group conversation around it? So I think there's a lot of ways that you can put this into your clinic that's maybe not super overwhelming, and you can start slow and then grow and grow and grow to a place where you feel really comfortable.
Well, you kind of mentioned this, that the pharmacologic options for weight management are really advancing rapidly, which is so exciting. How do you see these therapies being incorporated into rheumatology practice?
I mean, I think we're here. We're in an era where even if you wanted to ignore it, or even if you thought this was going to be a fad, you can't. You can't ignore it in rheumatology anymore. So our patients are already on these medications, and they will get them any way they can. And some of those ways maybe not exactly the safest. So why not take that into our own hands? And I think the real issue for prescribers right now is finding the right education. And so take this into our own hands and talk to the patients and be the one to prescribe the medication and monitor those patients as they continue their weight loss journey, their reduced inflammation journey. And we see our patients more frequently than a primary care provider. So why aren't we the ones checking in with them and making sure that they're safely using their GLP-1 medications to help with that weight reduction and the disease and use them as disease activity modifiers, actually.
I love that. We're here. And I totally agree with you. And somehow we have to, I think, all incorporate this, because you're right. They will go to any means to really get some of these therapies, and we are monitoring them so frequently. Why are we not doing it? I mean, I think we will be at some point. I think it's going to be pretty mainstay in rheumatology in the not so near future, if it's not already. So talk to me about, tools, resources, patient education. How are you supporting your patients through lifestyle changes, conversations, et cetera, into your own practice?
Well, I think it's important that it's just not the prescriber that's educated on these medications. If we're specifically talking to embedding that into our practice, that your staff, your nursing staff also knows what they're talking about when the patient calls in with potential side effects or questions about dose increase. So first of all, sort of started the foundation, and I think helping your whole entire staff become educated about what we're doing. And that can be done very easily. A brown bag lunch, put something up on a projector and talk about it. You can also put little things up in the room. I mean, I know posters and sometimes things like that can cause conversations that maybe make the visit go longer than somebody might want. But also it can be a way to start talking about it with your patients and using a poster or something that has how fat cells are inflammatory. And then this can lead to that. And there's ways to kind of start the conversation with the patients. And again, I do think that group conversation, so allowing like an evening time where you have patients come in and talk to multiple patients at one time, number one, that's efficient, right? So maybe they want to talk about it at the appointment, but you certainly don't have time because you're running 20-minute appointments, 10-minute appointments, whatever you do. You can say, you know what, we have a seminar coming up this Thursday night. Why don't you come? And we'll talk all about this, and then we can discuss it at another visit. So I know a lot of us, time is really the issue, and to add yet another thing to our bread and butter rheumatology practice, which is very important, and don't lose sight about that. But there are ways to do this without kind of cutting into the bottom line or cutting into your time.
I love that idea. And I think if you have the means and the ability to have people come in and talk as a group, I totally agree. I think that is such a great idea. And it also gives the patient other support. I mean, that's why, traditionally things like Weight Watchers and some of these other places worked, because people got together and they were able to talk, and so I love that idea. Now kind of looking ahead, or as you may say, we're already here. How do you see the role of rheumatology providers evolving when it comes to addressing obesity as a part of comprehensive psoriatic arthritis care?
I think rheumatology providers love science. And if we have enough out there to educate us that this is an important topic, because if we reduce the adipose tissue, X, Y, and Z happen, then as rheumatology providers, we're going to buy into it. But if we're just saying you need to counsel your patients on weight loss and exercise, that's what we've been taught our whole careers, and we try and we try and we try, and patients get frustrated or offended. So I think that now that we have such great science behind it, you'll see rheumatology providers grab onto it, latch onto it, because we like talking about it. We get excited about it. And that if we're excited about it, then our patients will be excited about it.
Well, I couldn't agree with you more. Any last minute thoughts, comments before we end today?
No, I just appreciate the conversation. I think this is something that we all need to talk about, and we've learned other mechanisms of action and disease modifying agents year after year. And I think this is just another one. And I don't think we need to be too intimidated about it, but just learn and do our best for better outcomes for our patients.
Well, again, thank you so much, Jeannette. I just value you so much as a colleague, as a friend, as an inspiration to the field. So you're out there doing it, and it's just so amazing to see everything that you're doing right now. That brings us to the end of this episode of RhAPPcast, the official podcast of Rheumatology Advanced Practice Providers. Again, Jeannette, thank you so much for sharing your insights and helping us rethink how we approach weight, wellness, and psoriatic arthritis through a more compassionate and clinically grounded lens. To our listeners, thank you for joining us. We hope today's discussion equips you with the practical strategies to initiate stigma-free conversations, integrate obesity assessment into routine psoriatic arthritis care and really all inflammatory arthritis, and consider how your clinic can build or strengthen an obesity-focused treatment approach. As a reminder, RhAPP's new regional meetings are going to kick off this April, and that's an opportunity to connect locally, learn collaboratively, and bring practical, case-driven education directly to your community. You can also explore more rheumatology-focused digital learning anytime on the Content Room, RhAPP's digital hub, available at rhapp.org. Be sure to subscribe to RhAPPcast for more episodes designed to elevate clinical practice and support you in delivering exceptional rheumatology care. Until next time, keep leading with curiosity, compassion, and clinical excellence. Thank you, everybody.